Hi, everyone. Welcome to What's New and Coming Up with Lipedema. I'm Leslyn Keith. I'm the president of the board and director of research for the Lipedema Project. And I'm here with my friend and colleague, Siobhan Huggins.
Hi, I'm the research specialist in a failed plant mom at the moment.
Siobhan is a little bit depressed because she's been experimenting with caring for plants, and she had a little bit of a I would not say it was a learning experience. Tell everybody what happened, Siobhan.
So I have two plants at the moment. My snake plant got sunburn and had to have some amputations done. But after a few weeks, it's actually doing fine at this point. My zebra plant, however, the pot was not draining properly, so it got root rot, which I think zebra plants are prone to, and it's dead now. I did not notice in time. But I quickly messaged my mom to ask if, because the leaves are intact, it's just that the roots rotted out. So I messaged her to ask if I could wait for them to callus and then propagate them into new plants, because you can often do that anyway. Yeah. So it may actually come back to life. We'll see.
So if anybody has any plant suggestions, go ahead and post them in the chat. And we're just always looking for, who is out there who's listening. We'd love to know where, as we continue on, if you have any comments or questions, be sure and do that. We're going to talk briefly about something else that's happening in Siobhan's life, because you've been seeing a certified lymphatic therapist who luckily was right near you in your town. And it's been an eye-opening experience in a lot of ways. But it's really turned into this collaboration between the two of you, figuring out what's working for you. Tell us some of the things you've been learning, because I know you guys have been experimenting with a lot of different techniques.
Mm-hmm. Yeah, and we started kind of with the basics, just exploring a little bit, doing hands-on MLD, and then...
And say what MLD is?
Manual lymph drainage. So a massage technique to help stimulate the lymphatic vessels and get the fluid out of my legs and then also my arms. And along with that, you do deep breathing and lymphatic node opening, whatever stuff. But so we've kind of gone from there, and we've been working together since October, so a good amount of time at this point. And often during appointments, we'll also just be chatting. So I'll be talking about keto or just lipedema, hypothesizing in general. And sometimes we'll get into hypothesizing between ourselves as well. Like, oh, I wonder if this could contribute. I wonder if this could contribute. And then we'll kind of tool experimenting in me to see what happens. So one of the big things was we started talking a little bit about lymphatic bottlenecks. So at the joints, essentially, and then at the armpits and the inner thigh and stuff like that. And how if those points are wrapped up in fibrotic tissue and scar tissue, then you may be essentially compressing really important points for getting fluid out of that limb. So we targeted a lot of fibrosis breakdown techniques with the machine-assisted cupping in those areas. And I would also be doing stuff by myself on my own in terms of like adding in fat fasting and things like that in between sessions. And that resulted in, for one, less swelling in my calves, because that's where I was getting a lot of the fluid buildup. And at around the same time, I had full body decreases in swelling. Wow. So the cuffing in my ankles has actually become a lot less noticeable, especially in my right ankle. The ankle now looks very smooth on the right side. There's still a little bit of a cuff on both of them, especially on the left one, but it's decreased substantially, and that's largely from reduction in fluid, so the tissue isn't being pushed out so much. And then, like, we'll keep going and building up the intensity of the machine-assisted cupping and stuff like that. And sometimes we'll go, step it back a little bit if there's other stuff going on and my body's already overwhelmed with stress or whatever it is. But then we just kind of keep talking about stuff like, oh, what if this, what if that? And eventually I was like, well, we're focusing on these singular areas and we've made a lot of progress with that. But what about all the other lymphatics? Like there's lymphatics all around the leg. And it's like, yes, there's these major pathways, but what if we also focus on these other ones now? Because we've made so much progress. Like, why not just expand out at that point?
Right.
So that's what we've been doing lately. And I responded really well to it. So what we're doing is we have just regular hands-on MLD first. So doing that massage technique to open everything up. And then we'll go in with the machine-assisted cupping and do kind of more aggressive. And part of that is also negative pressure on the tissue. So if there is fibrosis in that area, it helps break it up.
So when we talk about negative pressure, everybody can think of it's more like you're lifting the tissue rather than compressing. A lot of times you think of doing a massage on someone, you're pushing down into the tissue. And that is also a way to break up fibrosis. But what you're talking about, Siobhan, with cupping, it's like lifting the skin up. You're causing that, you're making that space in there.
Yeah. And we found that I respond really well to that. And so we started, she kind of refers to it like a wrap. So we're taking that cupping and not just doing the single line up to the inguinal lymph nodes, which is between the pelvis and the thigh, but actually going all the way around. So we'll work on my front first and then flip me over and work on the back and work all that fluid up. And then she'll work it up to the abdomen and then stimulate the abdomen so that we can fully get it out so it doesn't get stuck anywhere else. And what we found with that is it was way more effective in terms of getting fluid out of the tissue. And like we talk in kind of holistic terms a lot. So, oh, your body really seems to like this. It responds really well. So that's what we're currently experimenting with. And I guess the main reason I wanted to talk about it is like, can be so exciting. Like it is part of care, but you also discover so much about yourself. And like behind a ketogenic diet, working with a lymphatic therapist has been the #2 thing that has done the most in terms of reducing swelling, reducing limb fatigue, just
fibrosis.
Decreasing fibrosis, able to handle dietary things a lot better. So being able to have a little bit of dairy at this point, mostly cream and not so much cheese, I'm finding out, but still, like, I didn't think I would be able to reverse that through improving my lymphatic health, which is super interesting and opens up like 10 billion different, like, oh, I wonder why that is. I wonder how that contributes, all of that stuff. And just learning a lot.
Let me ask you one thing about this, Siobhan, because when you decided that, well, I think I want to look into this, having a certified lymphatic therapist work on me and do this, how did you find the person, someone who is certified? And then how did you make sure that this person was a good fit for you? Can you tell I'm sure we have people listening that have not seen a lymphatic therapist before, and maybe you're interested in finding someone. Could you give some insight on what you did?
Yeah, and I think like the step before finding a lymphatic therapist was getting the courage to look for one in the first place, because there were a couple of things that I had to take into consideration for my own situation, which was, for one, budget. I knew I wasn't going to go through insurance. I was just going to pay out of pocket because it's streamlined. It's easier for me. But at the same time, like, I own my own business. It's doing well, but it's also still in its baby stages, which means I need to budget accordingly. And the other thing was time. So I do run my own business. I also volunteer for the Lipedema Project and Lipedema Simplified. I do research stuff. I do presentations. I have a lot of stuff that I need to focus on. And that meant, like, I can't go every day that is just not possible for me.
Right.
And so when I was looking at my budget and how much it would cost and all this stuff, it's like, well, I can only really feasibly do this once a week. And I talked to people in tribe and it's like, is this going to be enough? Like, is this even going to do anything with once a week? And, you know, some people said, no, I don't think so. Others said, you know, try it and see what happens. And you can always discontinue it if you're not in a place where you can get the care you need doing it once a week.
Right.
And so largely the way that I got motivation to seek this out was by talking to people in the community, and just kind of getting their experience and their recommendation. And part of it was also at the October event, I think, either that or the Lipedema Awareness Month from last year. But talking to people and being like, they were just telling me, like, you really need to do this. You really need to at least try it because, like, you're so early in. Like, what if this is a big thing for you? What if this helps over the long term and you don't, like, all of this stuff? So it's like, okay. Right. So then we enter the stage of actually trying to find someone. And luckily, again, I had recommendations from you and other people in the community. And I just went to the closed training site. They have a directory of providers. And I looked for someone who was in my area, and then I just started calling people. And typically I would get voicemails, but I would call and say, hello, I'm so-and-so, I have lipedema. Do you have experience working with lipedema? Can you give me a call back, et cetera, et cetera. And then when they called back, I would ask in terms of, do they have openings? Are they accepting new people? What was the cost? So I got a couple different people, and they all had varying costs of how much each session was. And then eventually I found someone who did have experience with lipedema. They did have experience doing manual lymph drainage. They were taking new people and they were within my budget. So I set up an initial appointment with them for an hour and a half. And then our appointments after that have all been an hour because that's what I have time for. And just kind of went from there. And it ended up being that I actually really liked her. So not only did she like fit all these check boxes, but when I met up with her, she was very scientific minded. She was very excited. She was open to trying different things as we kind of went along, open to experimenting. And she was also willing to communicate with me throughout the whole thing, not only in terms of how comfortable I am, but I was also specifically requesting, like, when you notice things, can you tell me? Like, can you describe what you're feeling and noticing so that I can learn more about it too? And you're not just giving me like a filtered version of what you think I'll understand.
Yes.
Because
so she was actively asking for your feedback so that that can come into the equation of, you know, am I going doing the right thing, or is this beneficial? So very, very important. I want to just back up to one comment that you made earlier, and I want to give this information to everybody. The Close Training, you went to the Close Training website. That's Close spelled with a K, because Gunter Close has a school for training people to be lymphatic therapists, to treat lymphedema and lipedema. And I will say mostly lymphedema. Not every Close trained therapist comes out and, you know, from that experience and is good with lipedema. So you notice that Siobhan questioned her about this to make sure that she was familiar with lipedema and had some ideas on what to do for treatment. So Catherine, I'm just letting you know, I put in the private chat a link to the Close Training Therapist Directory. And so you can click on that link, and it will give you a list of therapists throughout the country and the world. So it's mostly in the US, but we have trained therapists throughout the world. So you just put in like your zip code or something like that, and then you can hopefully find one near you. But just because they're listed on here doesn't mean they know lipedema. And that's why Siobhan talked to them to be sure that this was going to be a good fit for her. But I think it's also important what you said too, Siobhan, is that after working with her, you really found that, yes, this really is a good fit because you guys, you thought the same way, you were interested in the same thing. So I think it's just as important for us, if you were to get if you were going to get a oncologist who was going to help you with your cancer, you got to have someone that you really like working with, someone that you trust, someone that can be a nice partnership. And so you talked about this, Siobhan, that as you guys were continuing to see each other, you found that, okay, this is a good relationship. This is a positive relationship.
Mm-hmm. And the other thing worth emphasizing is, like, sometimes you don't have to do the maximal possibility. Like, not only has once a week been better than nothing for me, it's been wonderful. Like, it has done so many wonderful things. And not only does it decrease swelling directly afterwards, it's had impacts on my lymphatic health in the longer term. So between sessions, overall improvements. Yeah. And sometimes,
and in your case, Siobhan, it may be that you need a little bit of recovery time, because
that is true. Yeah,
intense stuff. It's not just the typical complete decongestive therapy with pretty gentle manual lymph drainage and then maybe compression bandages or other stuff. You're doing pretty intense stuff, and you might actually need that recovery time in between visits.
Mm-hmm. And it's important to emphasize too that even though we're doing more intense things, we're always checking in to make sure it's never painful. Sometimes it is uncomfortable, but we're checking in to make sure we're not going too intense to the point where it's going to overwhelm or potentially cause damage or things like that. And then also paying attention to how tired am I afterwards. Like, if I'm tired in the evening or through the rest of the day or whatever, and then the next morning I feel fine, totally cool. If I'm tired into the next day and beyond, nope, we got to dial it back.
Yes.
And we've been able to do such intense work because my pain is managed so well. With a ketogenic diet, I have basically no pain. And that means that, you know, my body's probably in a better spot where it can handle a little bit more intensity.
Yes.
But if I were coming from, you know, not as well managed, kind of still working through stuff like this, then we would take it a lot slower and a lot more gentle until my body was ready for that next step.
Right, right.
And
there was an interesting article. They were just talking about these surgeons who do liposuction surgery on lipedema. And they said that we like to do the liposuction and then do conservative treatment afterwards, and which might include diet. But interestingly, this is completely opposite from what the liposuction surgery Dr. Amato does in Brazil. And he uses a ketogenic diet, manual lymph drainage, and water exercise prior to surgery, and gets, just as you're experiencing, the tissue has improved health. And he believes that then the surgery is less traumatic, and there's better healing from the surgery afterwards, if you even decide to still do the surgery. So I kind of like the way he does it first, but I would also recommend to do, if you're going to be doing surgery, to do keto and other conservative measures prior to surgery, and then do it again after. I just think that you're going to have much better outcome with combining all those things.
Yeah, and you're kind of doing this thing where you're trying to be kind to yourself and your body, because, like, imagine if you're in this state where you're not in a healthy spot, your body is really struggling, you're seeing that present as very severe lipedema symptoms, and then you go in super intense. Like, the body does have limited resources and limited amounts of what it can handle. And you're just adding problem on top of problem. That may not be the right way to go. Like, sometimes do it in phases, go slow, and pay really, really close attention to how you're responding, and make sure you're ready for what you're doing. Because even if you can't do it right now, like, we know conservative treatments can really improve things. So you may revisit at a later time and be like, oh, this actually isn't so much of a big deal anymore. Now I can do this next step. So focusing on the nutrition aspect and compression and gentle MLD and things like that, and then, like, upgrading as your body's ready for, I think is so, like, it's powerful. It sounds cheesy, but it's powerful because you're just preparing your body for that next thing and then doing it instead of pushing everything all at once.
Mhm. And Sarah just posted that she believes that our advice is spot on. So a good way to look at it. Barb says she had her first MLD yesterday. And I asked the vascular surgeon, I saw if he knew of anyone, and he did. So I guess he referred her to someone to see for her MLD. And he knows lipedema. And he loves that I use I guess, VP vibration plate.
That would make sense.
Exercises to do at home. So it sounds like you've got a really good physician to collaborate there with. Julie says hi from North Carolina. And I know I saw Julie Rosa from Camarillo, my neighbor. And Desiree asks, who do you recommend for surgery? And Desiree, we don't really recommend a certain person. We're much more in favor of doing non-invasive conservative measures, but surgery can be very, very good for a lot of people. We always recommend that you post your question on different lipedema sites. You might be part of a Reddit group, or you might be part of a Facebook group. We have our lipedema simplified support Facebook group. You can post on there, and women will respond, and they will tell you who they liked and who they didn't like and why. So I think that would be a much better place to go. I can't really recommend a certain person.
Yeah, and when you do that, you can also get hands-on experience with the person. So how attentive were they? How familiar were they? Because you're not only looking for things like liposuction, you're looking for things like lymph-sparing liposuction, specifically for lipedema, that they take care afterwards. And so, yeah, I would recommend getting recommendations from other people who've gone through it, and then kind of seeing who's near you or who you can travel to, and then just kind of plan it out that way.
Yeah. So this has been a wonderful discussion about doing conservative therapy and getting a good lymphedema or lymphatic therapist on your team. I want to just tell everybody about a couple of events that we have coming up, just so you know about what is other new and things coming up. And we have, of course, Lipedema Awareness Month coming up. We're going to have a challenge where we're going to have certain dates. This is all free of charge. Join us for these dates. You can see posted June 7, 8, 9, 10, and 14. We're going to be talking, well, Siobhan's, of course, going to be talking about nutrition and then giving you some things, some small steps or big steps that you can do right away. And you can report how you do with the challenge. So be sure and sign up for that. We'll have the link to get more information and to sign up. And then another thing that we're doing during Lipedema Awareness Month is our meetups. We're getting together in person. Siobhan, you're hosting one in Denver.
Yeah, we found a little cafe with parking and everything like that. I think mine is on June 24th, but I don't even have to know off the top of my head, because you can just go to the link right down there or wherever it is. And we have all of the spots listed. I think we're up to 15 at this point. Some of them, like a lot of them are in the US, but there's also, I believe, one in New Zealand. I think one in Canada as well. Yes. There might be more at this point. So just go there, and then it lists the date, and then you can also click in and it'll take you to the sign up. And then also where it's at. So you can plan ahead of time, know if you need to travel, all of that. So when we're looking at putting this together, it's sharing a cup of coffee or tea or water, or whatever your preference is, maybe a snack or something, and just being able to get together with other people who have lipedema and having that shared experience with locals, with people who are near you that you can see in person and talk to. The other thing I wanted to emphasize about the challenge also is we were just talking about being gentle and take it slow.
Yes.
That's what the challenge is going to focus on in large part. Challenges can sound super overwhelming, like 100 push-ups a day challenge, whatever. Not what we're doing. We're looking at things that we can implement today that are not going to be overwhelming, that are going to be gentle, that are going to take in your past experiences and what you've struggled with in the past, and be able to put together a plan that's going to take those things into account so it's not so hard to do.
And talking about being gentle with yourself and being safe, Ka, I think is how you say your name. Is it safe to use as a vibration plate when you've had a knee replacement? This is the type of thing that we will be talking about during our Lipedema Awareness Month at the challenge, because we want you to be safe and gentle. And I will tell you just anecdotally, Gail Straker, one of our other women on the team at Lipedema Simplified, she has a vibration plate. She also has, I think her knee replacement is about 15 years old. There are some precautions to take. And your lymphatic therapist, your certified lymphatic therapist is going to be your best friend and help you guide you your particular situation and what is going to be safe for you. That person is going to be a good person to have on your team. It's hard to just look up on the internet and, well, I guess I'll try it this way. Because I think you're right to be concerned. Is this going to be safe with my knee replacement? So I do believe, yes, it can be safe, but you're probably going to need some good guidance just to make sure that you do well with it. That's not totally off the table. And I'm going to have one more announcement to say before we close, because we're coming up to the end of our time. And good, Kai, you're going to ask your therapist. Good job. So another date to stave is going to be our Heart to Heart, our 3-day virtual collaborative event is coming up October 27, 28, and 29. 3 full days of really looking at the holistic approach to managing your lipedema symptoms. And remember, our events are collaborative. So you're going to have an opportunity to talk to our fabulous speakers, talk to vendors and people who make things for lipedema, and talk to your peers, other people who have lymphedema and or lymphedema. And so be sure and save that date. We'll have some more info coming out on that. I think we're going to be putting some links to get more information on that, but mark your calendars, October 27, 28, 29.
Yeah, so I think we've covered a lot of stuff.
Yes. Siobhan, thank you so much for sharing everything with, this is a very personal and kind of intense relationship that you have with your lymphatic therapist. And thank you for sharing that stuff with everybody, because it kind of gives people an idea of what to expect, what to look for. And so this is good information to have when you're kind of on deciding whether or not you want to talk to a lymphatic therapist for yourself or not.
Yeah, and I think it helps a lot because it's not like my experience with lipedema is all sunshine and rainbows and positivity and blah, blah, blah. There are difficult days, but at the same time, if you're working with someone who is experienced and who can help you experiment, you can approach it in terms of a puzzle, in terms of empathy for your body, in terms of trying to learn where it's struggling, and then also where you can help and where you can support it. So every single session going in and just doing a check-in, like, how are you doing, body? How can I help? What are you struggling with? Where should we focus today? Should we take it easy today? And I don't know, just building that relationship, I think, is really important, because then if you do have a tough day, like, it's a lot easier to say, you are struggling today. We're struggling today. And that's okay. We're going to take it easy today. And we'll revisit the more intense stuff a different day when you're better equipped to handle it.
Yeah, great. Thank you, Siobhan. Very well said. And it has been wonderful spending the time with all of you again on Friday, as we do every Friday at 1:30 Eastern time. It is always so great to just talk and see what everybody posts, and to have a nice conversation with you all. So we'll see you again next Friday, and hopefully at our Lipedema Awareness Month activities. See everybody. Bye-bye.